Hi, my name is Nassim Zecavati. I am an associate professor of both pediatrics and neurology. I'm a pediatric neurologist at the hospital, and I'm just excited to be here to talk a little bit about some issues that are near and dear to my heart. Are we going through and doing introductions, or are we just starting?
Actually, let's do all. I would love to hear from all of you right now.
Sure. My name is April Sizemore-Barber, and I am a assistant professor of the practice in Women's and Gender Studies program, maybe soon department. Who knows? But really excited about some of that's happening.
Hi, I'm Jenny Klugman. I'm the managing director at the Georgetown Institute for Women, Peace and Security, and a fellow at the Women in Public Policy program at the Kennedy School.
Great, thank you. Nassim, go ahead.
All right, it's great. I've got just a few slides. I'm going to see if I can go ahead and advance. Perfect. And there is our first slide. So, this is a topic that sort of I became interested in about 2 years ago, and started sort of taking a little bit closer look into compensation for female women physicians, and noted a very interesting disparity, and sort of started to investigate a little bit further why that disparity exists. And that is, I think, going to be a great topic of discussion for us today. So last year in JAMA, there was an interesting article titled "Sex Differences in Physician Salary in U.S. Medical Schools." It was published in September of 2016. And essentially, the conclusion of the study was that physicians with faculty appointments at approximately 25 U.S. public medical schools, so this was data that was publicly available, it was noted that there were significant differences in salary, even when they adjusted for age, for experience/seniority, specialty, so this medical specialty, the faculty rank, assistant, associate, professor, chair, taking research productivity into account, and clinical revenue, so how much a physician was generating. Even when taking all of those factors into consideration, there was a significant pay gap between men and women. Interestingly, the largest gaps existed in certain fields, which included hematology, oncology, neurology, which is my field, cardiology, obstetrics, orthopedics, and surgery. So that sort of led me to look a little bit further at data that I had access to see if I could sort of tease apart why it was that there was this gap, and to try to understand it a little bit better. As a member of the American Academy of Neurology, I had access to a survey, a compensation and productivity survey that essentially provides benchmarks of compensation and productivity for neurologists in the United States. And so the survey was open for approximately 6 weeks, and members of this professional organization, about 15,000 members, were invited to participate. Out of those, about 1,400 completed the survey. The nice thing about completing the survey is that you would then have access to the results. So you could say, okay, I completed the survey, which was kind of it's a little bit on the longer side, and it's very technical. I think that kind of scares people away. But the nice thing about completing it is then you can look at the data, and then you can see how you yourself compare to benchmarks in the U.S. So the most recent data was just published in mid-July, so relatively new information. And just to give you sort of an idea of the gender distribution of neurologists that are part of the AAN, in the United States, we're looking at a significant split, about 60, I'm sorry, it's not easy to visualize, but 65% male, and about 34% female. So this is a field that is more males, I would say, than females, whereas there are other fields that are a little bit more equally split, but certainly neurology is one that is heavily skewed towards males. This is sort of a breakdown of, and this is not a slide, I'm just going to go past it because it's not easy to see the various specialties that the individuals who completed the survey were in. And then I looked specifically at the pay gap by the setting, academic setting or private practice setting, and then looking at gender specifically. And so what I found was that in academic medicine, there was a pay gap of about $28,000, meaning that men had a salary that was roughly $28,000 greater than women. When I looked at hospital-based practices, I found that the gap widened to over $49,000. Multi-specialty practices, so this is a group maybe of various specialties that, like a private practice group, $42,000 gap, and then a neurology group either existing in a hospital or outside of a hospital was the largest gap at about $51,000. So then I looked at RVUs, which is a term, relative value unit. So this is a term that is used to sort of measure a physician's productivity. So if you are in a surgical specialty, traditionally you generate higher RVUs. If you do a procedure, you generate more RVUs. If you're a primary care physician and you're doing a well-child check or a primary care visit, you actually generate fewer RVUs. RVUs in most institutions are tied to your salary and your compensation. So I looked at that to see, well, how much are these physicians generating, and is that somehow tied to the pay gap? And so in an academic setting, what I noticed, excuse me, was that the RVUs were a little bit lower for women, 2,957 versus 3,200 for men. And again, that pay gap was about 28,000. So we're like, okay, well, maybe that explains the disparity. But then when I looked at the hospital-based neurologists, the women were generating more RVUs. Yet there was a significant discrepancy in their compensation, and they were actually being paid less. So you could sort of make the argument, well, they're actually generating more revenue for the hospital, but the hospital is actually paying them less than their male counterparts. Multi-specialty practice, the RVUs, 4,600 versus 5,100, that, to me, that's not a huge difference in RVUs to explain a $42,000 gap in compensation. And then the neurology group, significantly, I would say the men were producing more RVUs, and I think that was reflected in the pay gap as well. So then I looked at specialty to see if maybe there were certain specialties where within the field of neurology where perhaps there was a trend to explain this, and it was hard to make. It was hard to know. I mean, there were certain specialties, behavioral neurology, where the gap was a little bit narrower. I think that the highest gap was in neuromuscular medicine. And the reasons for that are not entirely clear. I don't have a great explanation for why the gap tends to be larger for certain specialists than it does for others. So I ended a little bit early. I'll give you my sort of thoughts on this. This survey doesn't ask all of the questions that I would want to ask, and I've actually been working with the survey administrators to try to insert more questions into next year's survey so I can better understand the association, better understand why it is that in certain fields, such as neurology, women are being paid less even though they're generating in certain fields, in certain settings, equal RVUs. I think that in medicine, I think that maternity leave is a significant factor. I think that oftentimes women, myself included, will have a baby and will take 3 3 months is actually generous, so 3 months off to spend with your newborn child, and then you'll come back to work and you will have lost 3 months of productivity. And over time, you would think that that 3 months is sort of, yeah, you know, you'll make up for it over time, but honestly, it becomes difficult to achieve parity because your productivity has gone down. So when we looked at those RVU numbers, those revenue value units, relative value units, those RVUs for the year are going to be lower. And that means that you were less productive that year, which means that your compensation, which is tied to your RVUs, is probably going to be lower. So if it's lower that year, then it affects you the following year, perhaps even the following year, and then let's say you have a second child, and then it kind of again, you're affected by it. And so I've noticed that, I have certainly noticed that, and I've had meetings with administrators in our department, and that is always one thing that I sort of try to bring to the forefront, that, you know, there are certain reasons for this. And so I think that we have a long ways to go in sort of making the work environment family friendly. I think that the way we measure productivity and the way we measure value is something that needs to be thought about, and some things that maybe we could do to be a little bit more cognizant of these things. Because when you think about it, when someone's salary is lower, they're putting less into their retirement. And so it actually affects them at multiple levels. And then when they go for a contract renewal in a few years, it becomes that much more difficult to renegotiate. Everything is sequentially affected. And I think that one of those significant factors is maternity leave. And I'd love to hear if anybody else has had similar experiences in other fields outside of medicine, because I think that in medicine it's a pretty big factor for us.
Thank you. Perfect. 10 minutes on the dot.